Hello, I'm Mari Beasley, and today we're going to learn a little bit about cognitive behavior therapy, or CBT for short. First, let's start with the history and the founders of CBT. Dr. Albert Ellis was inspired by Austrian psychotherapist Alfred Adler, who in the early 1900s had the notion that basic mistakes played an important role in unpleasant emotions. This inspiration led Dr. Ellis to develop rational emotive behavior therapy, or REBT, in the 1950s. REBT focuses on changing irrational beliefs into rational beliefs. The therapy stems from the idea that a person's emotional distress arises from the thoughts about an event rather than the actual event itself. Then, in the late 1960s, Dr. Aaron Beck developed what is commonly known as CBT. Dr. Beck's theory guides clients to question and challenge their dysfunctional thoughts, try out new interpretations, and apply an alternate way of thinking. An interesting fact, Dr. Beck is 97 years old and he is the founder of the Beck Institute. If you would like to learn more about Dr. Beck and cognitive behavior therapy, you can visit the Beck Institute website at www.beckinstitute.org. Now let's talk about the basic principles of CBT. In the book, Cognitive Therapy, Basics and Beyond, by Judith Beck, there are some outlines to use for the basic principles of CBT. It emphasizes the present. It is goal-oriented and problem-focused. It has structured sessions. It requires a good client-therapist relationship. You must have collaboration and active participation. And importantly, it teaches patients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. It also uses a variety of techniques to change thinking, mood, and behavior. Some of the most common therapeutic techniques used in CBT are journaling, or gathering data about your moods, their source, intensity, and your responses to them. Unraveling cognitive distortions. Become aware of the distortions you are likely to be vulnerable of. Cognitive restructuring. Challenge your harmful or destructive beliefs and reconstruct them. Play the script until the end. Finish the worst case scenario in your head to see that everything will likely turn out okay. Relaxed breathing. Bring regularity and calm to your breath and create a sense of balance. According to the Mayo Clinic, CBT is a useful tool when dealing with emotional issues. Some of the emotional issues that can be addressed using CBT are dealing with stress, managing emotions, resolving relationship conflicts, coping with grief, overcoming trauma related to abuse or violence, managing chronic pain, coping with a terminal illness diagnosis. The Mayo Clinic also recognizes CBT as a treatment for these common disorders: sleep disorder, sexual disorder, depression, anxiety, obsessive-compulsive disorder, eating disorders, substance abuse, and post-traumatic stress disorder. In a school setting, there are ways to implement CBT in your classroom. The main thing a teacher needs to do is hear how a student says things and then address the situation if it could be said differently. Here are some examples of how students may think and how CBT can help redirect that thinking. I'm a failure. I can't do this, so I give up. I didn't get it this time, but if I keep trying, then eventually I will. She didn't speak to me when she passed me in the hallway. She probably doesn't like me at all. Maybe she didn't see me, or she has something on her mind. It has nothing to do with me. As you can see, CBT has a lot of uses. I hope that this video has shown you all the different ways that you might be able to use it either in a school setting or as a therapist. Thank you very much for watching, and have a great day.